So, Happy New Year to everyone. This is Annie the pharmacist back again with another topic today. This is another big one. It's heart attack, also called myocardial infarction. Now, heart attack, what is it? It's simple. A simple definition for a heart attack is when the blood clot blocks blood flow to the heart. That's just it. Blood clot blocks blood flow to the heart, you get a heart attack. The longer you stay before getting treatment, the more damage is done to the heart muscles, leading to death. Now, one of the causes leading to heart attack is diabetes. And as I mentioned in my diabetes video yesterday, diabetes, the disease itself causes hardening of the arteries, which is atherosclerosis, leads to heart attack. High blood pressure, high cholesterol, obesity. Obesity is simply being overweight. Stress, CAD, which is coronary artery disease, little to no activity, poor diet, and smoking. That's another big one. Now, the symptoms of a heart attack could come with chest pain or discomfort. So you start feeling chest pains or discomfort in the chest area, feeling weak, lightheaded, or faint. You feel like there's pain in your jaw, neck, or back, or pain in one arm or both arms or shoulder, and it also comes with a shortness of breath. Now, as they say, prevention is better than cure. So, what we'll try to do to prevent a heart attack is lifestyle changes. So, that's a big one. Lifestyle changes, just as with diabetes, lifestyle changes helps to prevent heart attacks. Eating healthier, increasing your physical activity, that's like exercising, managing stress. I know some people will say it's easier said than done to manage stress, but you have to try. You quit smoking if you do smoke. Take your medications as prescribed for high blood pressure and for diabetes, etc. Now, you find out that heart attack is a medical emergency. So you'd want to try to get to the emergency room as soon as possible, because some of these treatments may require, depending on the severity of the heart, they may have to do CPR on you, which CPR is cardiopulmonary resuscitation, or they may have to do defibrillation, which is shocking back the heart so it start beating again. Now, and as I said, that also depends on the severity of the heart attack. Another procedure they may do on you is either a coronary stent or coronary angioplasty. What a coronary stent is a tube that is placed into the arteries to keep them open. The coronary angioplasty is them unblocking the artery by inflating a balloon inside of the artery, and that facilitates with blood flow. Now, medications used are anticoagulants. So first, they're going to try to slow the clotting process of the blood. They are going to use drugs like heparin or apixaban. Apixaban brand name is Eliquis. Different countries may have different brand and generic name. Well, the generic is going to remain the same, but the brand name is going to be different. So here in the US, you have apixaban, which is the generic, but Eliquis is the brand name for apixaban. You have rivaroxaban, that's another generic. The brand name is Xarelto, and dabigatran, where that is the generic. The brand name for that is Pradaxa. And as with any of these anticoagulants, you have to be careful how you take them. Take them as prescribed. Follow the instructions very well, because they can cause excessive bleeding if not taken the right way. Also, it can just cause excessive bleeding. That is a side effect of this medication, and there are antidotes for them, which I will get into in another video. I'm trying to keep these videos as short as possible, so let me know if I'm going too fast. Antiplatelet drugs, again, that's like aspirin, clopidogrel, which is the generic for Plavix. Plavix is the brand name, and you could be on this for a while, like maybe 2 years, 3 years. So prevention again is better than cure. You also have anti-anginal drugs, and angina is basically just pain in the heart, right? Chest pain, that's angina. So anti-anginal drugs are drugs used to combat chest pain. These reduce, as I said, it reduces chest pains. You are going to get into the drugs that's like nitrates. And these are nitroglycerin, isosorbide dinitrate, or isosorbide mononitrate. Those are the nitrates, and those are anti-anginal drugs that reduces chest pains. Beta blockers. These are a set of drugs that slows heart rate, so therefore it reduces how hard the heart has to work, and it lowers your blood pressure. Then you have the statins. You get into the statins. These, as soon as you hear statin, these are for cholesterol, high cholesterol. So you have atorvastatin, rosuvastatin, anything with statin, right? It decreases the liver's production of bad cholesterol. And then you have your ACE inhibitors. These are going to lower your blood pressure, and they are going to prevent damage to the kidneys. So they relax blood vessels, they lower blood pressure, and prevent diabetes related kidney damage. And that's when you get into drugs. They're called pril. They end in pril, PRIL. You have lisinopril, ramipril, etc. Now, as I said, I don't want these videos to be too long. So if there are any questions, feel free to reach out to me in the comment section. And again, have a happy 2024. I hope you have a prosperous, a safe, and a healthy one. Thank you.